Good evening. I'll call the June 19th Services Committee meeting to order. I just want to start out noting due to extenuating circumstances, Legislator Trippinelli is excused from this meeting this evening, and Legislator Jeanette is attending remotely from 1350 County Route 53, Great Falls. But I'm sure he'll. Okay, great. I get a motion to approve the agenda, please. Current Perkins. All in favor? Any opposed? Next, may I have a motion to approve the minutes? Ms. Curran, second by Mr. Forsythe. All in favor? Aye. Any opposed? First up, we have Social Services. Commissioner Seaver is joining virtually.
No,
Isn't
one
there?
there.
Okay. Well, as we fetch Commissioner Seaver, our first resolution is authorizing the chair to sign agreements with the St. Lawrence County School Districts for space located within the facility. Get a motion, Mr. Perkins, seconded by Ms. Curran. Good evening. You're all right? We're ready on the first resolution when you are.
Apologies. All right, our first resolution.
You read it.
There you go.
Sorry. We are committed to decentralizing a little bit and providing services where they're needed across the county. We would like to do that by partnering with local schools. A lot of the cases that we get originate schools. I think it's a value to us and to the community to have a presence in the schools. Try and maybe address some of these cases on the front end, and if not, at least to provide some education or assistance to some of the schools as necessary when we can. So this resolution is to allow the chair to sign agreements with the schools as we increase our roster. Right now, we have presence in Old Pierpont, Ogdensburg, we're working on Herman Kell. There are some other schools that we are hoping to get into soon. I put them on. So now I'm asking you to approve this resolution so we can continue to try to expand.
Is there any discussion? Ms. Curran.
I'd like to say thank you for you doing this. I think it's very important to have people that are in a safe, neutral place for the kids to be able to come talk to. It doesn't mean that they have to call the police or go through some reporting process. I think it's a great idea. Thank you.
Any further discussion? All in favor?
Aye.
Any opposed? Our next resolution is authorizing the chair to sign a contract with Carol L. Full-Marl for cleaning services for the Department of Social Services satellite office located at Howard Gate Commons, 280 Main Street, Messina, New York. I have a motion. Ms. Curran,
This resolution is to add language into the lease to include our cleaning services. There's something that we missed on the front end. We need to make sure that this is done. This is the same person that provides cleaning services for the other county properties at Harrogate. So we'll be using the same group, and just ask that we get pass this resolution to include that so we can take care of those cleaning services.
is there any discussion? Hearing none, all in favor?
Aye.
Any opposed? Right. Our next resolution is authorizing the chair to sign an amended lease to include trash removal fees for the Irrevocable Spousal Trust, FBO, Richard E. Magan for space located at Howard Drive Commons, 280 Main Street, Messina, New York. Have a motion. Ms. Curran, seconded by Mr. Smithers.
Again, this is for our Messina satellite office. We're as we're moving on and we're utilizing the office, we're finding all the things that we didn't really get to in the beginning. And one of them is trash removal. We're working with the village on that. So this resolution is to allow us to set up the trash removal with the rate of $25 a month for the facility. So I would ask your indulgence on this resolution.
Any discussion? A good price for trash removal. Okay, hearing none, all in favor?
Aye.
Any opposed? Okay. Next, we have social services statistics.
All right, well, again, good evening. I'm gonna go through the statistics with you, give you some highlights on these. I'm looking at page one. We had a total of 166 referrals in the month of May, which was up by one from April. We were at I think 165 in April. We have a total of 354 children involved in those referrals. Also on this first page, you'll notice that we had our 100% for a couple months in a row, but we hit 98% for the safety checks that month. We're still chasing perfection. We're working on it. We're still well above the state average and the state median, and I prefer us to stay there. But that's where we are for the month of May. So, if there are no questions, moving on to page two. On page two, one thing I want to talk about is our CPS caseloads. We have them down to 10. They're starting to creep up a little bit. We're at 13 for the month of May. We had a number of vacancies, number of people out sick, which contributed to that for the month of May. Additionally, as we get these vacancies and we bring people on to fill those vacancies, they have an extensive training period they have to go through before they can touch a case. So while the vacancy numbers may not reflect the fact that we have a bunch of people missing, I have a bunch of people that can't take cases. And some of them, the most recent ones that came on, based on the state's training schedule, won't be able to touch a case till October. So I anticipated this creep up a little bit. I don't anticipate it getting out of hand. I also anticipate it coming back down because we have some good processes in place right now to make sure that we're staying on top of this. But that's kind of where we're at. 13, the state recommendation is 15. We're still under that. We're monitoring it closely, and I'm going to meet with the Children's Services leadership every week to keep an eye on this and determine if there's anything we can do to tweak the process in the meantime to keep these caseloads where they need to be. Total cases for the month of May was 396. We were down from 391 in May. We closed 134 cases in the month of May. So we're still doing our best to close out those cases, to tackle overdues, and keep those caseloads down as much as possible. So, if there are no questions, we can move on to page 3. This is one that I'm particularly happy about. The first graphic shows that our total children in care is 221 in the month of May. Now, if you remember going back a couple years, if you go back to calendar years, 2021 till now, April of 2021, we had 339 kids in care. We're down to 221. That's an outstanding job done by my staff, but also by the legal staff of Mr. Moulton, to get these kids moved through the system to adoptions or wherever they need to go so that they're no longer in care. So I really think that that's a feather in the cap on people who've been doing that yeoman's work. The average days children have been in care a year ago was 698, it's down to 693, not a great drop. But as we get the kids out of care, a lot of the ones that are leaving are the ones that are the easier cases. That leaves behind all of the more difficult cases who tend to stay in care longer. So seeing any reduction in that number is significant. We continue to try to work to find different options for some of these kids to get them where they need to be. So, moving on to page 4, there are no questions. Our foster care prevent caseload remains stable at 10. I think that's a great place to be there. These are, again, foster care preventative. That includes my adoption staff, the ones who are working with these kids that we take into care to make sure to get them where they need to be and work them through to some degree of permanency or stability for these kids. On page 5. We had only 2 adoptions in May. That number's down a little bit, but we have adoption packets in the double digits that have been prepared and sent over to the courts. So I expect the next month or two to be busier with some of these adoptions, and we can get that number of kids in care down even farther. I'd love to see it get below 200, definitely before the end of the year. I think that's a reasonable goal to look at. On page 6, which will be the last page of these statistics, our homeless placement, they have been high. April, we were at 36. We crept up a little bit to 44 in May, which is significantly down from where we're at in winter time. One thing that's not on the list, but I would like to brag a little bit about is our homeless services unit has now moved 39 adults and 20 children to permanent residents that would have been homeless since we started working with them this even at the end of January. So in just a few months, we've seen some significant changes. A lot of that, we had significant traction working on that when we just had the examiners working on it. But then when we added the caseworker, it really added another level to the services we're being allowed to provide and help these people with. So I want to give kudos to their staff for assisting these people with their homeless situations. So, does anybody have any questions on anything in the services packet?
Mr. Wester,
Just a question on the,
your microphone.
just a question on finding a permanent placement for homeless. Is there a service or something that follows behind them to make sure that it's working out? So a month or two down the road, they're not out of homeless again.
It depends on the situation. Some people need a little bit of help. You got them, they're in an apartment and they're doing their thing. Some people we moved to working with like transitional living services and some other moving into some single resident occupancies that have some wraparound services and some follow up. So it depends on the individual situation.
I hate to see it moving to permanent housing and a couple months down the road, they're back where we are now.
That is our goal, is to avoid that.
Good job, good job.
Thank you, sir.
Commissioner, I had a question. Page 2,
Yes, sir.
bottom, unit average cases closed. I'm just seeing quite I would think significant difference in the lowest number in that paragraph and the highest number, 1.3 being the lowest and 6 being the highest. Can you just help us understand what would contribute to that much of a difference in the number of cases closed?
I think certain caseworkers, based on their tenure, based on their experience level, have some of the more serious cases. Others do not. So, when we have somebody that has some serious cases, they may only close 1 or 2 in a time period. Some of the other ones, they're 3, 6, or 7 or more. So it just depends on the complexity of the case and which caseworker is working at the time.
As a follow-up, is there a standard measure of the complexity of a case? So we could understand potentially how that weighs in.
Yeah, there really are no metrics. I mean, the complexity could be based on legal status. It could be based on questions of parentage. It could be there's 100 different variables that could lead to the complexity of the case. So I wish I could put some metric to it, but I don't think that's possible, sir.
Any other questions for the Commissioner? Ms. Gardner?
Just as an example of what he's talking about. Say you have 2 people calling on one family in 1 week and they have 5 kids. That makes 10 different cases. If those 10 cases get merged together under one social worker, you've now closed 5 cases in 1 day. So then if, it all waits till you go to court, then you can close 10 in a day. It all depends on what it is.
It was just a slew of variables there.
Anytime we put it into a chart, we're oversimplifying it by necessity, so I know I appreciate that. Any other discussion?
So when we're asked to simplify our reporting to you, we brought forward the concept of bringing to 1 month children's services like this report, bringing the eligibility component to the following month, and then to finish the quarter, so to speak, with a report on findings. And that would be what you'd be seeing tonight. Well, with the exception that we aren't quite ready, that's not a report we have been providing. And so we're working through what metrics make the most sense. With the complexity and challenge of that budget, we want to bring you something that's meaningful. And so we asked the chair of the committee if in fact we weren't ready, we didn't want to just put something out before you to have it done, that he would allow us to bring children's services again updated for you. But also in terms of scheduling and timing, as you heard, I think, from the treasurer of social services, we'll see reimbursements based on a quarter sometimes. And so we thought if we could switch it up so that the finance report came following the month of the quarter, that might hold more value for you. And so that would actually be in July. And so we'll continue working on it. And our hope is that we could bring you finance in that month following quarter, bring you children's services and eligibility, and then start again. So on a 3-month cadence each quarter of the year. So that really was the thinking, if anyone was missing, that was part of what we're working on. Thank you.
Any other discussion? Thank you, Commissioner. Next, we'll move to community services. By Mr. Orchak. Our first resolution is authorizing the chair to sign agreements with Claxton Hepburn Medical Center, the Children's Home of Jefferson County, and Dr. Richard Leota of Clinton County for administering 7:30 psychiatric examinations. A motion, Mr. Smithers, seconded by Mr. Burke.
So, in terms of the 7:30 evaluations, last year we had approximately 8 requests for evaluations. So year to date, we already have 11. So, I was talking with Claxton, we had a 5-year contract that expired in March. They lost a psychiatrist. So they said they're having trouble keeping what's going. So I moved forward and initiated contact with a PhD psychologist, Clinton County, that I've known previously, as well as the Children's Home of Jefferson County. So I'm asking to be able to sign contracts with those 2 entities in addition to renewing the contract for Claxton, so we have adequate coverage for the 7:30 event.
New discussion. Hearing none, all in favor?
Aye.
Any opposed? All right. The next resolution is authorizing the chair to sign a contract with NTC Systems Incorporated for security system monitoring and maintenance for the opioid treatment program. Motion. Second by.
So we have the security system that was installed by NCC for the OTP. Covers the entirety of the services center, part of the office, things like that. But we're asking to renew the security system monitoring maintenance contract with them. You have money staff block grants for this purpose. So the yearly contract is $50.
Any discussion? None, all in favor?
Aye.
Any opposed? The next resolution is authorizing an intergovernmental transfer for an upper payment limit modified in 2023 budget. Community service. Start. We did B.
Oh.
Yeah, sorry, yep. So it's 4C on the agenda. I'll just reread. Authorizing an intergovernmental transfer for an upper payment limit and modifying the 2023 budget for community service. Mr. Forsythe, seconded by.
So I believe this is the 3rd year that CMS is doing this reimbursement for it's a comparison of Medicare rates versus Medicaid rates. So they're giving us, what they think we would have recouped if we were getting paid Medicare rates. So in order to recoup this money, we have to put 43.8% of the total payment of $50,228. You have to pay that in. That's our federal share in order to recoup the $52.28. So it's a little. We've been doing it for 3 years. It's a little strange, but that's the way we do it. So if we pay for the federal share, then CMS will reimburse us. And the problem being, we got this letter on June 6th, and of course, it was a resolution. So we're hoping to get a check cut for this purpose and attach the resolution.
Is there any discussion? Hearing none, all in favor?
Aye.
Any opposed? All right. Next resolution is the modifying the 2023 budget for community services for funding received from New York State Oasis to St. Lawrence County as pass-through funding to approved agencies. Mr. Burke, second by Mr. Smith, and Ms. Graham.
So this is an increase for the Oasis state aid downstream providers due to the 4% cost of living adjustment that was approved in 2023, 2025. So we have the three providers listed here, total $57,913. Living between the three. We also just got a state aid letter from health with a similar course. It's like somewhat with the rest. Not being shown here is the St. Lawrence County increase for state aid because of the 4% COLA is 14,200.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? We have a program services update.
So, just so you know, we have about 900 covered lives right now. We did get, I'm gonna go a little off topic. We get our parks. And so why that is important is we have been what they call doing bundled codes for OTP services. So a bundled code might be they received a week's worth of medication. Say they came in one Monday and they got a week's take home, but then also during that week, they saw a counselor, they saw a prescriber, they saw a peer, they saw a nurse. So we bundle those codes in a G code. And G codes are primarily for, well, they're initially for Medicare. And Medicare does not credential an OTP until 1 year after it opens up. They have to go through PARP accreditation. So we recently had the PARP accreditation. We were expecting a 1 year accreditation. They gave us a 3 year certificate. And had a lot of exemplary things. So in terms of delivery of services, we're spot on. Why this is important, so we got to turn this around to SAMHSA, who will then, based on PARP's recommendation, 3 year recommendation, they will credit us. From there, we can go to the other payers, meaning Medicare fee for Medicaid fee for service, and also Medicaid managed care. So we've been working with Fidelis, which is 71% of the OTP pay for all the individuals that we see. It's, I think it's 7. So 71% of those individuals have Fidelis. We've been working with Fidelis, and they pretty much committed to going back retroactive, paying on those G codes that we have not been first. So, that's, I don't want to count my chickens, but I mean, they pretty much put it away. So that's why this accreditation is so significant. And we're also working with United Healthcare, our second biggest payer, to see if they'll follow suit. So this is, really, going to boost the revenue once this all goes through. So we don't know how long it's going to take for Medicare once they receive the sanction notification. Credit us because Medicare is slow. It's federal government. So it might take a month, might take 2 months, take 3 months. We don't know. But hopefully this is going to open up a revenue stream that we've been denied since we looked.
I was down here from yesterday. Certificate.
Yeah.
Mr. Ray.
Congratulations, and please thank your staff and tell them that we appreciate their hard work. And it must feel good to have that outside praise for what you and your staff have achieved.
Mr. Burke.
Jay, you mentioned that you've been submitting bundled services. Is that as compared to this?
we don't have to bundle, when billing, we don't have to bundle. We can break it down in individual services by the regular, they call it APG rates. But, you know, most OTPs do the bundled rates. It's more efficient. It's just, we had an additional problem. We tried to unbundle and bill the insurances in the unbundled rate, starting about a month ago. And the hiccup with that was when trying to get reimbursed for the medication itself, which is a J code billing. 1011, our software company, didn't have that set up correctly, so we weren't getting paid for that. So we were getting some monies, we weren't getting reimbursed for medication, which can be significant with Suboxone. It's like $7 tablet. So yes, once this is all approved, we're going to stick with cheaper. I'm not sure if I answered your question.
Well, I guess I was just trying to. It sounds like you've made great strides. I'm not sure that certainly the certification. Was it Samsung?
Well, it was CARF. It was one of the, it's a higher level, like we get surveyed or we get audited, or whatever you want to call it, for our operating certificate, agencies. But this certification has a higher standard than even exists.
Does that mean higher?
It doesn't affect the reimbursement. Those rates are set by the state and by.
It sounded like you were saying we're finally going to get paid for services we haven't been paid for. So
That's
maybe that's the takeaway.
that's what we're being told, and that's what I'm hanging my hat on. But you know, I'm optimistic. I'm not 100% confident. I believe it when I see it, but that's what. Then we'll go down through the line, try to do the other managed care payers that what's a significantly less percentage of the OT patients coverage. See if we can't get them as well. But that's even more of a projection.
Agree with Jim. Thanks to you.
Jay, if I'm understanding correctly, us being able to bill with the bundled codes doesn't necessarily increase our reimbursement, but it decreases our administrative costs, the efficiency of the billing process internally, right? Is that right? Okay.
And hopefully likely to be paid.
Right, it also simplifies the claims process, right? If we're denied, we can address that in a more efficient way.
So Medicare is on the top. And because Medicare wasn't paying these G codes, then the Medicaid managed care companies weren't required to pay on the G codes either, because Medicare was denying that because that 1 year period of waiting for the accreditation through CARF, and that gets sent to SAMHSA and that gets sent to Medicare. So that's it's hopefully a trigger for the money to start.
No other questions right now, I guess we continue with the citizens.
Can I say one more thing?
So we have a projected revenue for all clinics. That includes local revenue, state aid, and federal grant funds. That projected revenue is just shy of $3 million. If you take Q1 revenue, those same 3 buckets, project that out the fourth quarter. So let's just say it would be we continue to have the same amount of revenue the next 3 quarters that we did with Q1. And we won't, because we did spend down a lot of grants, say that. But we would be at 260 or 2.68 million. So we'd be around $300,000 shy. And these are, you know, and I say this, these are reports that we get, you know, from the EHR. And we do our best to try to make sure that they're accurate. That projected revenue. That's the important one. Shy.
Jay, just one question on that. Looking at the revenue, what do you know what percentage of that is accounted for by grants or other state aid or other income sources like that revenue?
We just ran this today and I didn't get that breakdown, but I can get that.
All right, I think that'd be helpful.
So in terms of the clinic update, we did make a few changes. There wasn't much significant change in terms of the no-show rates, a little bit up. You know, clinic averages were up slightly last month. But when the next 2 graphs on page 1, instead of doing individual counselors, we moved that to an aggregate monthly production rate for those 2 metrics. So at a glance, to see, I always had to calculate, you know, where we were at in comparison to last month, present that. So now I don't have to do that anymore because you can see the aggregate, you know, production rates for the month for the clinics. But really it's more of a monthly trend. They're easier visual. So it says on here the wait list is 24. We're actually down to 2. Those 2 have been lost to contact and sent letters out. Response to the letter, closing them. So essentially, for the first time, we do not have a waiting list. We do have a waiting list in addictions clinic. 7.
You might, just to understand that correctly, so the May number for mental health waitlist was 24. You're saying since that number was measured, it's gone to 2, but effectively 0.
Correct.
Okay, that's a significant change.
So if you go down to percentages of dollars paid of billed services, those are not really pretty numbers right there. So what we looked at, you know, in the electronic health record, for pulling these numbers out of, is we've obviously had a lot of denials. And then when we go and rebill for those denials, could be, you know, a second time we bill, could be a third time we bill. And if we continue to get denied, those numbers in the number of claims and charges. So when these percentages, they are against not just one-time denials on the same claim, they're percentages of sometimes 2, sometimes 3 denials of the same. And once that claim is paid, there's duplication of those same numbers for those same claims goes away, goes back to 1 instead of 3 claims. Follow. So because of that, I mean, you know, these, I'm not saying the billing's been great. You know, I'll be the first to admit it's been a struggle. Everybody in the room knows. But I don't know that it's quite as bad as it looks because of the numbers just keep cha-chinging every time we, you know, we resubmit a denial. So for instance, if we had 100 claims and we were denied 50 of those claims, it'd be 50%. But if we had 100 claims and we submitted a denial a second time for each of those 100 claims, so then then the number would be against 200 claims, then we'd be down to 25%.
Mr. Forsyth.
know what I'm thinking. I'm not sure I know how to ask.
Okay.
Let me try that. thing. So how many times you rebill twice and 3 times?
Sometimes, not every claim is billed 3 times.
Okay, but is it 3 strikes and you're out, or would you continue on hoping to get reimbursed, or?
Well,
We would continue to try.
Okay, so these claims could go back all the way to July of last year?
It depends on the payer. You know, some have a 60-day period, you know, you can submit denials. A lot of them have 60-day, you know, time limits for processing denials. You brought up a good point. I'm not sure if we put in a second submission for claim, I don't know if that restarts.
Mr. Ray.
So,
Say they reject it. First time, second time, the third time. What process, if any, is available to us? I mean, if you guys know you provided this service, and you guys know that you're owed this money, what is the arbitration or, appeal to a higher authority if they're not paying?
Well, see, different payers require different methodologies. So someone, you know, the HCPCS code, someone of the state codes, and they're pretty particular about how they want that claim moved out. And what we learned by getting in contact with Champlain Valley Family Center, because they were on site, we were helping them, and because they're going into the mental health, they're going to be co-occurring with mental health. So we were helping them with their process, learning OMH rules. In the meantime, you know, we were looking at their setup because they use 1011 as well. And through that process, we learned that our setup from 1011, our current vendor for electronic health record, was grossly incorrect. So it really wasn't the payer's fault. It was because our electronic health record was not set up properly. So we've been working diligently with 1011, the vendor, to try to get this straightened around. And we are making progress, but it's one of those things that we haven't billed for almost 2 weeks because we're trying to get this set up correct. And we're about at a point where we're going to do some test batches to see if the changes in the setup that was recommended by 1011, because we got another, the person who originally set us up is gone. She left that agency. So, you know, we really pushed to get this other individual involved with our setup to get this corrected. So we've been meeting, you know, it was like 3 times a week to try to get these set up, the changes correct. I still think there's a little bit of a process moving forward. I mean, I would far from say that, I'm pretty confident that these changes as per their recommendation, everything's good to go. I think we still have quite a few ones to jump over, but we're gonna be starting a test batch. Hopefully see what the response is. It'll take a while to see what the response is from, what's there's their accounts to the payers. So we see. I don't know if that answers your question.
No, I share your frustration. It must be terribly frustrating. Here it is, you have a supposedly sophisticated computer system that is supposed to be able to do the billing process correctly. And to learn that whoever set it up, that it's not doing what you're paying them to do, must make you nuts.
Well, in all transparency, the person who was working with 1011 during that setup period is no longer with our agency. So, 1011 was saying, well, we told her what to do. She didn't set it up right. And I don't have access to her knowledge in terms of that process. So, I'm like, I'm not even gonna get into that. We just
Jay, do you know off the top of your head what the county pays for that EMR on an annual basis?
I don't have that in front of me, but it's quite a bit less expensive than what we were paying.
Depending on how you measure it, yes, but maybe in the grand scheme, the answer would be different. But okay, if you could name that number, that'd be useful. I do want to know. So the double counting or
It's approximately a little over $3,000 a month. I don't have the exact.
$3,000 a month.
A little over.
That wasn't the startup expense. That's just the ongoing cost, right?
Yes.
Just one question on the last chart on page 2. You mentioned that if a claim has not been closed out and it's been rebilled, those rebills are counting on the denominator of this graph.
Correct.
Whereas there's nothing on the numerator, right? So it's like you said, that example. I know your team is working on this. I know you're in discussion with the EMR about the urgency of fixing that bad data issue. I just want to in this forum, want to make sure I communicate that does need to be resolved. That's not that information in this chart is not communicating anything of value to us. It's just noise. And so it really makes these numbers.
But we recently learned that.
Sure, yeah, exactly. And I'm glad we did with that due diligence of looking into these statistics. But I know you're aware. I just want to take the opportunity to communicate that in this forum, that it's a high priority issue to get those numbers. To remove that noise so we know what these percentages are.
I mean, and that's kind of why I kind of gave the projected revenue versus Q1 revenue and projected that out over the next 4 months. It's not 100% accurate, but it's a little better than what's up. And that, same way with the chart on the top of page 3. It's the same. Continue doubling of the number of claims filed against the number of claims paid. In terms of the percent of services provided but not billed, I mean, that's really simply has to do with untimely documentation notes that are being completed by the clinicians. So we do have corrective action plan.
Yes, are there any penalties for something who are responsible for closing notes or late closings?
Well, I mean, because we have, looking at these numbers, I mean, we have basically set out a memo stating that you would be denied vacation if you don't ask.
Yes, recognize Mr. Sober.
So I just want to clarify to they were. So just to clarify on the issue of the chart on the bottom of page 2 versus the one on the top of page 3. J is to- A little bit more of an issue on the chart. That we are pulling every month, those data points again, to see what comes in beyond the initial 3 months. That chart on the bottom of page 2 is typically pulled once at the 90-day mark, that three-month mark. And then is not, those prior months are not re-updated again, so it's losing percentage there. It's more of an issue on the chart on the top. There's probably maybe some instances of pulling within that 90 days, but not quite as much of an issue as it on page. And that's why you're not seeing anything in that second category of revenue that's captured beyond the 30 month. Because that's when it's counting the denial 2 to be 4 times, reducing our percentage.
Sure, everyone got that 100% right. Okay. Any further questions or discussion? Mr. Burke.
Just the comment, 75% of police debates for mental health is exceptionally good.
Thank you. Moving on to public health. Case Munger. Our first public health resolution is authorizing the chair to sign the emergency preparedness program contract for the public health department. Can I get a motion for that resolution? Mr. Smithers, seconded by Ms. Carter.
Thank you. So the first resolution is to sign a contract for our emergency preparedness program that we use to plan for any type of public health emergency, hopefully never another pandemic, but also pandemic. It is for the next year from July 1st, or for this year through next year, July 1st of 2023 through June 30th of 2024, an amount of $87,445, which is the same as it was last year.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Next resolution is modifying the 2023 budget for the public health department for epidemiology and laboratory capacity, reopening schools. Motion, seconded by Ms. Barrett.
So this is for one of our COVID grants. This grant was specific towards helping out schools with the testing requirements that were placed on them. It's been a difficult grant to try to execute. We've had 4 different project managers in the last year and a half on this one through the state. So the funding could have been used for coordination, management, technical assistance, data collection, and then it did get expanded out to other supplies, and then most recently it was expanded out to daycares and then summer camps. The grant does end the end of July, and we had originally, because we didn't think we were going to spend a lot of the money, left it in the restricted amount in our munis budget. So we are looking to catch munis up to what the actual grant funding was.
Any discussion? Julian, you might read, right, the grant was for 3.4.
3.1.
3.1.
Okay. Oh, yes, no, 3.4, yes.
And then we spent a total of 1.6 of that.
Yes.
And what happens to the remaining amount?
It goes back to,
So we forfeit that.
yes,
Okay.
and this is one of those grants where like we didn't even expect to spend close to
Sure.
what we did on it. And so we were actually able to help out a lot of the schools, big time, and some of the daycares with expenses.
Any other questions? All in favor? Any opposed? Yeah, Bill. Next, risk management. Resolution adopting a health and safety policy manual for St. Louis. Denisha, seconded by Ms. Curran.
So this is a resolution to adopt a health and safety manual for the county. Want to thank Mr. Denisha, helped me work on this quite a bit. Many of our health and safety policies were in need of being updated. And this kind of pulls everything together in one manual to make sure that everyone's on the same page. OSHA in New York State is enforced by PESH, which is the Public Employee Safety and Health Administration. They do require that we have certain written programs detailing safety procedures and policy, topics like bloodborne pathogen control, fall protection, topics like that, safety related stuff. And this consolidates everything and makes sure that we have all the necessary policies in place to be compliant with the PESH regulations.
Mr. Smith.
Is it our requirement or expectation that all of our employees read this from cover to cover?
Not every policy will be applicable to every employee. The expectation that PESH puts out there is that the manual will be available to any employee that wishes to review it. So it will be a document if somebody requests it that they will be able to read, but it's not going to be mandated that everyone reads it cover to cover.
Very extensive.
Yes, yes.
Mr. Denisha.
Thank you, Mr. Chair. This is something that been near and dear to my heart. We started down this road 6 years ago, about 6 years ago. And as we recognized that we did not have a safety and health, a documented safety and health. Started with Paul Baxter. And then Jody came along, and I was really happy that Jody, because I had experience working with Jody. Skill set. And he brought this to fruition. I know it's difficult, it's very dry reading, so I'm sure no one has read it all. It is dry, but again, it's critical. It's critical that it's the safety of our folks that work for St. Louis County, visitors, contractors. But we have to be, it gets us into compliance. And the other thing I want to say is that we talked about the risk manager position back when we hired Paul back. And there was quite a lot of discussion about the added expense. But we finally got to where we looked at his position as not expensive avoidance. And Jody has gone around to the towns, within the county, all the municipalities, fire departments. He has conducted audits, very good audits. And I have had nothing but positive feedback from all the towns, all the fire departments in my district. He pointed things out to them that where they had an opportunity to reduce risk. And he did it in a manner that was not threatening. They asked, well, can you help us? And he would give them some ideas as to what to do. So again, really thank you for following through on this. Thank you for getting it done. It's a good document and serve us well.
Any discussion? Any known areas where we'll need to change our operations or process or procedure to comply with the new policy?
So the one area that we may need to take action on is some of these policies require annual refresher training, depending on job title. Obviously, you know, any staff that works in an office doesn't need to take fall protection. But for our highway, buildings and grounds, certain positions may need to start participating in an annual refresher. And that training has been required. Unfortunately, we're a little deficient in some of those areas. I have started doing some of that already with our buildings and grounds and highway staff. I'm gonna pull solid waste into that as well. So that's gonna be something that once this is in effect, I will start working towards scheduling that on an annual basis and make sure they get that. But outside of that, I don't believe so.
All in favor? Oh, Mr. Denise?
Just one,
We can, yeah.
Mr. Chair, just one last thing. And I'm not sure how many folks are aware of it. Jody's actually been scheduling OSHA safety training classes on weekends for town highway departments, fire departments. At no cost.
All in favor of the resolution?
Aye.
Any opposed? Thank you. We have vacancy review.
Only one department to come before you, with a short list of vacancies and requests. Commissioner?
Only two this month. The first vacancy I have is a senior social welfare examiner. The incumbent in this position had previously been a social welfare examiner, was promoted to senior. After a short time, decided that it wasn't for her, when to go back to being a social welfare examiner, so she went back to her original position, leaving this position vacant. This particular position works in our TA SNAP unit, and provides a lot of guidance to the other senior welfare examiners there. Not having this position could lead to additional errors. We could have inaccurate payment amounts, late payments, et cetera. So I ask your indulgence in filling this position.
Questions? Okay. Motion carried.
This position, a little bit of a background. We're abolishing a keyboard position to create a social welfare examiner assigned to the Children's Services Unit. While doing exit interviews for keyboards, one of the things that was a common thing, there were several common things. The first one is they all said that they were overworked. They all said that they were overworked because they were doing work that they felt was not in their class, which had to do with writing payment lines for various accounts. That is social welfare examiner work. To try and bring things back in line, we decided to eliminate one of the keyboard positions to create a social welfare examiner so we can have people working in class, doing the work that they're supposed to do. And this will also take some work off the rest of the keyboards to hopefully alleviate the overwork situation. So once we get them, they won't be leaving us in the future. So this position is going to be working with our eligibility units to determine our Title IV-E. Very important to make sure that we get all the eligibility funds that we get. So I would ask your indulgence in abolishing the old position and creating this one, to try and keep things in line.
Questions? Okay, thank you, Commissioner.
Thank you.
Next, we have Patty Administrative Report.
Yes, just a brief report. I asked Commission to stay in case you wanted to add any comments. I just wanted to mention and bring your attention tonight that we have been talking for several years about bringing some type of training for our field staff in social services and making sure that they are equipped in the tasks we assign to them out in the field in the world we live in today to be able to take care of themselves. Happy to share with you that Commissioner has rolled out some defensive tactics training voluntarily to staff Making it available, also, I think, has garnered some conversation because now other departments are making requests. So if you'd like to, I'd like to comment on your plans there.
Yeah, the classes that I've taught, based on years of experience, I was a law enforcement and corrections instructor for many years. Basically, to help our staff, not learn to fight, but learn how to escape. How do we get out of different holes, grabs? A lot of talk about situational awareness in the top, a lot of talk about the legality of abuse. It's the staff that have gone, have really enjoyed it. They've asked for additional classes. I think it's a value. Again, something that people need to practice, but I think if we don't give people the tools and they find themselves in a situation, particularly in today's world where things can go south very quickly and things are much different than they were even 5 years ago. I think that we're doing ourselves a disservice if we don't at least make it available to our staff.
Wanted to let you know that tomorrow at SUNY Canton, NIPA has scheduled an event to essentially celebrate the completion of their phase 1 Smart Path. I will have staff in attendance at SUNY Canton tomorrow. They are now, as you may be aware, in the process of the Smart Path Connect, and that is a different direction. So this was from Messina down to Marcy. This new project is Messina over to Plattsburgh. So if you have any interest in going tomorrow 10 to 12, let me know, and we'll make sure we get folks, make folks aware over at SUNY Canton by the attendance. And the only other item I wanted to mention was we were successful in hosting on June 13th. Department head and a few others. I had 18 department heads present, and we had 6 from either a junior staff perspective or outside to do an emergency operations center training with staff from the state. We're very interested in continuing that. I think we always have great conversations about that initial training, and then it's about that next level training with specified areas so that we are prepared in situations that we can't predict. So the successful, the full day training, well attended. And I think for the most part, when it comes to those things, it was a great training performed by our OEM folks.
Well, any questions for our county manager? All right, moving on to committee reports. Ms. Curran, Board of Health.
Met last May 16th. We talked about the lead update. They had 129 tests in the month of April, 76 active cases that they're tracking. No discharges, 5 new cases. They are looking for pediatricians and other PCPs, primary care physicians, to be able to do testing in their offices. They've noticed that if you give little Bobby's mother a lab slip and she's got to go to 2 blocks down to another building, you don't have people going very often to get this done. And the numbers you would have if they could just come in, collect it in your office and run it while you're there. So they're doing a little bit of education about that. Our sanitarian had 8 calls total. 2 were for garbage, 2 were for water quality. 1 was a septic system they thought was just kind of running them up into wherever it was. 1 for living conditions, 1 for indoor, outdoor air issues, outdoor air quality is 1. So then we moved on to walk with the doc. We have 2 things that are scheduled. 1 that was in May. I guess the other one was June 10th. I would like to see walk with the doc every month, especially during the summer, because that's when people are sort of falling out of their habits to go do things. So maybe we can have more events in different towns and get our people out exercising and talking to local physicians. Tick-borne illness. We have 10 cases of anaplasmosis between January 1st and the 30th of April. 5 of babyosis, which I can send everybody via email why it's important that we track these. And 133 Lyme disease already this year. And then they just, we talked about the community health assessment. It's going to be completed, well, this year, every 3 years. And our next meeting is tomorrow night. Does anyone have any questions? Yeah.
Thank you. How are the Lyme numbers, the new pieces for Lyme, and then the osises you mentioned before?
Yeah.
how are they reported to public health? Do you know what our capture rate is with the counties?
So we actually talked about that. So there's certain diseases that when people test positive, it's reported to the Department of Health. Dr. Healy, I think it was, going here, but I believe it was Dr. Healy who said he thinks some tests are maybe not reported because of the way that they're tested for. So I'm sure Jolene is actively looking into that because we had talked about it last month, but I'll ask tomorrow night where we are in that. But yeah, I will put together a little education thing and send it to everybody. It's just interesting because it's hard to track these cases. This is a lot of work for the Department of Health. People who are bitten by ticks are, I mean, they're plentiful. You might have 10 in the weekend at the local ER just on a Saturday that show up for it. So then do those people always go for their testing? If you treat them with there's some people that just treat them with 14 days of doxycycline when they get a tick bite. You never know whether they were positive or not. There's a lot of variables.
Mr. Forsythe.
Thank you, Mr. Chair. On the tick bite, 133, is that in a month or is that year to
From
date?
January 1 to the end of April, 133 positive cases.
Is that high, Jolene, as opposed to other years, or it just seems like a lot?
It is getting higher, and not all, not all tests are reported. Other tests, if your test.
Plus, that's probably off season, January to April.
That's
That's when they show the- Okay.
I got one more question. Ms. Gray, if we move to more point of care testing for lead, does that mean that we will not necessarily see those results being reported parallel to the tick question, or is it a different scenario altogether?
I think because a positive lead test has to be followed up upon, you refer that person to the Department of Health. Because in some cases, it takes the Department of Health and the Department of Social Services and a bunch of other people to work together to remediate where the child is living, track down like what they think the exposure is. It's a big deal.
Mr. Burke, CDP Board of Directors.
The Housing Choice Voucher Program has finally received funding as Head Start program. The year ended on June 13th for children enrolled in the program. And with the approval of the raise in the debt ceiling, anti-poverty programs will not face the anticipated 22%. Potentially, it will be 1 to 3%. And then flat funding may be expected for the next 2 years. Housing, the HCR, which I think is an oversight agency, I'm not sure, requested on June 5th a compilation of home inspections from the last 90 days. That's the first time. The plan is that an inspector, must be the state, an inspector from the state will come for 3 days at the end of June and re-inspect 25. Weatherization, 160 air conditioner referrals installed. Neighborhood centers, Amy Farmer, Governor, and as department, Tina have been hired as new neighborhood center directors. Completed most of their training. They're looking at setting up a mobile pantry, food pantry in Pierceville. That would be held at town hall on Saturdays. And the agency itself, CDP, is their yearly fundraisers are now in progress. But
According to my quick Google search, HCR is New York State's Homes and Community Renewal Program. Any questions? Okay, next we have Mr. Sarah Haggard, Community Services Board.
Thank you very much. We met on June 6th. We had two presentations from veterans groups that are groups that aren't affiliated with the VA. They're assistance to veterans, both being considered for funding through a REAP grant. Found that very interesting. Peer-to-peer veterans from Watertown and Homework. We will not be meeting until September now, the day after Labor Day. Thank you.
Next, we have Mr. Legislator Nisha with Office for the Aging Advisory.
Mr. Chair, we met on Monday, June 5. The Seniorama is coming back to San Jose County. This will be the first one since the pandemic. It will be held Monday, July 24th, the Aquasasni Bingo Hall. And there are seniors from all over the North Country that come. San Jose County, Franklin County, Jefferson County. It's well attended. A lot of vendors, folks that have booths, public health will be there. It's a great time. The senior picnic is scheduled for Thursday, August 17th at the Morristown Fire Hall. 9:15 is bingo, 11:15 is lunch, and 12:15 having musical entertainment. Again, I would encourage everyone, if you can find time in your day, to attend that, specifically to help serve lunch. It will be, it's a great day for seniors from all over the county. It gives us an opportunity to act with them and just to see some of the good work that the Office for the Aging does. There were Andrea wasn't there. She was ill. Jacob Comenius reported that there's 700 plus home delivered meals plans at this point, which is about double from what it was. So you've heard this before, but I'm going to say it again. We're still looking for volunteer drivers. Anyone who can spare a couple hours, one day a week, or whatever you can spare would be helpful. And the last thing, Barbara Bernie from Statewide Senior Action Council reported, she talked about scams targeting seniors. One of the big ones right now is people calling and saying, asking if you've received your new Medicare card. They're from Medicare. Hang up. Don't talk. Scam. Another one is texts on phones that for some reason they're targeting seniors, and it's Amazon is a very popular one now. Your Amazon account. I've had them myself. I don't even have an Amazon. So if you're looking for it, you click on a link. So anyway, it's just awareness. And our next meeting is September 11th.
Thank you, sir. You mentioned the volunteer driver program. I just want to draw attention to that. I know that need has been persistent for a couple years now. I know just in my experience working at the Center for Cancer Care years back, that program is a huge aid to people in all sorts of situations. Do you know, Mr. Denisha, what both the minimum time that someone would need to be able to vote to do that, and what the training and onboarding process is for that program?
Yeah, as far as volunteers, drivers for home delivered meals, that would be as simple as, it could be a couple hours. One day a week, could be a couple hours, 5 days. And what it entails, actually, is just going out with one of the folks that Office for the Aging, on the route that they go on, and give you an opportunity to familiar with the route, familiar with the people. And, it's a, I can't say enough about it. I've been doing it myself for years. It's just been a lot of sense.
Is there any old business? Any new business? So else do I need to enter executive session?
There is for the purposes of litigation, negotiations, and personnel, which is the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, discipline, suspension, dismissal, or removal of a particular person or corporation.
Motion to enter executive session, Ms. Curran, second by Mr. Perkins. The motion.
Move.
Vice President?
I wonder if, yeah. If I, all the, they